Excellent, excellent. Don't cut ties, huh? It's nice to still connect with academe. We'll talk about that today, the importance of academe in all this. Huh?
Yes, sir.
How's it going, Matthew?
Okay, yeah, it's live now. It's on a different link, so I need to paste it, but you may start.
Okay.
So welcome everyone to the International Federation of Medical Students Associations side event to the 71st World Health Organization Western Pacific Regional Committee titled Empowering Youth Action Towards Non-Communicable Diseases and Vaccinations Through the Lens of COVID-19. I am Leonard Lim from AMSA-Philippines.
And I'm Samantha Chong from AMSA Hong Kong, and we are your moderators for today's panel discussion. This event was organized by the IFMSA delegation to the regional committee meeting, and our fellow organizers are Riza Sugimoto from IFMSA Japan, Wong Fan from AMSA Australia, Xixian Woon from SMM-AMS Malaysia, and of course, our regional director and the head of our delegation, Mathew Chow from AMSA Hong Kong. And Mathew will also be joining us as a panelist today. Before we begin, we will be doing a brief introduction of our 4 panelists.
First, we have Dr. Vicente Belizario, who is the Dean of the College of Public Health at the University of the Philippines, Manila. He is the Center Director of the CMAO TropMed Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health. He has taught medical parasitology, tropical medicine, and public health for more than 30 years. He is currently an adjunct professor of global health in the University of Pittsburgh School of Medicine. As a doctor of medicine with specialized training in tropical medicine and public health, Dr. Belizario was former vice chancellor for research and executive director of the National Institutes of Health in UP Manila. After his stint at the World Health Organization Regional Office for the Western Pacific as a technical officer for neglected tropical diseases, he served as Undersecretary of the Department of Health of the Philippines. Next, we have Professor Roderick Salenga, who is a registered pharmacist in the Philippines with 16 years of combined experience in academic training, interprofessional education, pharmacy practice research, health systems development, pharmaceutical regulatory system strengthening, standards and policy development, and organizational leadership. He currently serves as a technical officer for pharmaceuticals at the World Health Organization's Papua New Guinea country office. He is a public health pharmacy professor at the College of Pharmacy at the University of the Philippines, Manila. He is also founding president of the Young Pharmacists Group of the Philippines.
Mr. Mathew Chow is the regional director of the Asia Pacific of the International Federation of Medical Students Associations, and IFMSA represents 140 plus national member organizations globally and over 1.3 million student members worldwide. Mr. Chow is a current medical student at the Li Ka-shing Faculty of Medicine at the University of Hong Kong and a graduate of the London School of Hygiene and Tropical Medicine's Master of Public Health program. Ms. Florensia Rahati Pujiani is currently the chairperson of the International Pharmaceutical Students' Federation of the Asia Pacific Regional Office. And this represents 21 countries, 33 member organizations, and more than 70,000 members across the Asia Pacific. Ms. Pujiani is a graduate of a Bachelor of Pharmacy from Udayana University in Bali, Indonesia, and she is currently pursuing her pharmacist professional license. She is also the recipient of the Most Outstanding Student of the Pharmacy Department at her university in 2019, and was second runner-up for Most Outstanding Student in the Faculty of Science in 2019 as well.
So now that we've introduced our panelists for today's event, we'll run through the objectives. So multiple WPRO member states have highlighted the importance of increasing the resiliency of our region's vaccination programs and strengthening countries' responses to NCDs despite the COVID-19 pandemic. As such, youth groups can play an important role in complementing government efforts in these areas. So the specific objectives are as follows: to give an overview of the WPRO thematic priorities concerning NCDs and vaccination in the context of COVID-19, to discuss context-specific approaches that member states have adopted on NCDs and vaccination, to discuss the role of the youth in addressing NCDs and vaccination on the local level, and to empower IFMSA Asia Pacific members to work locally and nationally in the aforementioned thematic priorities.
So I'll be going through the mechanics of today's discussion. So this will be following a semi-structured format guided by the questions that were prepared by the organizing team. And the discussion will be streamed live on YouTube. And one question for each segment, so NCDs, vaccinations, and intersectoral collaboration, will be taken from the comments section. These will be screened by assigned team members, and we apologize beforehand if we don't get to your question as we have a time limit. So this time limit will be a 90-minute event. And since we have 4 speakers, we ask the panelists to kindly limit their responses to 3 minutes each per question so that the event will end on time. Before we begin, the guide questions that the moderators will be using for the discussion may be modified or removed at the discretion of the moderators, depending on time and if the questions have already been discussed earlier in the event. So on that note, we can start asking our panelists some questions, and our first topic will be NCDs.
Thank you, Sam. So for the first question, this is addressed to everyone in the panel. What are the major challenges in our region in addressing non-communicable diseases? So perhaps we could start with Dr. Belizario.
Thank you, Leonard. I think the headline is that NCDs are still among the top 10. No, in fact, it occupies a number of slots in the top 10. Heart disease, cardiovascular disease, diabetes, lifestyle-related diseases, a major cause of morbidity, major causes of morbidity and mortality up to this very day, and the numbers are rising. And therefore, we must do more than the extraordinary to actually arrest the continuing rise of NCDs. But of course, it's multifaceted, and I look forward to discussing the different aspects of the challenges in today's session.
Thank you, Dr. Belizario. So maybe just a follow-up to that. So having worked in the Department of Health in the Philippines, do you see any similarities in tackling neglected tropical diseases and taking on the NCD epidemic nationally?
Of course, the diseases are not alike, but the approach to dealing with the 2 major groups of diseases in public health would be similar. Addressing the issue on policy from the top, providing the directions to service delivery, providing directions to the kind of education the younger ones must get so that they're prepared to tackle the major issues when they graduate and they face now the real world post academe. And of course, the practitioners delivering quality care for both NTDs and NCDs. These are the mid-level practitioners. I'm talking about the higher ups, the policymakers, the middle level. We deal with the service providers, we deal with our patients and the people or the population. So, and therefore, for both NCDs and NTDs, we make sure that our policies are updated, sharp, so that they deliver directions clearly to the service providers on what needs to be done, both for NTDs and NCDs. Service providers, we aim for quality health services delivery for both NTDs and NCDs. And lastly, down in the communities, the people, the population, awareness, and this is achieved by health promotion in public health, awareness and appropriate health seeking and health behaviors. So you see the parallelisms. 3 Ps, policymakers, practitioners and service providers, and lastly, the last P is the P and the people or the population. Thanks, Leonard.
Thank you so much, Dr. Belizario. Perhaps now we could move on to Mr. Salenga. So the question is, what are the major challenges in our region in addressing non-communicable diseases?
Thanks, Leonard. Well, as mentioned by Dean Belizario, the problem of NCD is multifaceted. I think it's going to be improper for us to just look at it one-sidedly. I mean, there should be different approaches in terms of tackling NCD because the problem is rooted from many factors. One critical item that I would want to raise is the accessibility of the services to people. And by accessibility, I'm referring to quality people-centered services that are truly responsive to the needs of the patients and which are utilizing culture-appropriate methodologies. Because oftentimes in public health, we are focused in terms of reaching the outcomes and the targets without necessarily factoring in the human component of our services. So I'd like to think that in addressing quality and addressing accessibility of services, we should also be trying to inject more of those aspects of patient-centered care. Because when we talk about NCD, the work does not end after the patient meets the doctor or the nurse or the midwife for that matter. In fact, the moment that he talks to us, healthcare professionals, that's just the beginning of the journey of the patient. So I'd like to think that we have to create support system when they go back to the community to further the work in terms of prevention and control of NCDs. Thanks, Leonard.
Thank you so much, Mr. Salenga. Now for the youth perspective. So this time to Mr. Chow and Ms. Pujiani. Perhaps you can respond to this given your positions that require you to oversee so many countries within the region. Maybe Mr. Chow can start.
Yeah, so firstly, I would really echo with what has been said prior in terms of how the importance of people-centered services and having culturally appropriate methodologies, because working in a position where, as Leonard mentioned, it encompasses the entire Asia Pacific region. It's a very diverse landscape in a sense, and it really isn't a one size fits all to addressing non-communicable diseases, but we do face similar challenges, such as, for example, the long-standing issue of an aging population. And even in countries that are rapidly developing, we do see a shift of the burden from communicable diseases to NCDs. And NCDs in a sense are so over-addressed in a sense that people may overlook the fact that it's still a major cause of disease burden. So it's really a question of how do we overcome this? And I think with this COVID-19 pandemic, it's really a chance to rejuvenate these conversations, because globally we've seen essential health services like NCD management, or even later we'll talk about vaccines or vaccinations, and how they have been put on hold or stopped in many different contexts because of the need to be in quarantine or the need to be sheltering in place and not leaving the house. So we often, with this pandemic, it really is important to not lose sight of other programs such as NCDs or vaccinations or the broader vision of UHC. And this pandemic has shown that, for example, in the WHO context, that the triple billion targets, each one is interlinked and each of the billions are interlinked. And yeah, so that's it from my perspective. Thank you.
Thank you so much, Mr. Chow. Ms. Pujiani?
Okay, thank you, Leonard, for that. And thank you also for the other panelists. I think I just would like to also interlink with what Mr. Belizario has just mentioned. I do believe that the focus is of tackling NCDs is still in the treatment, that's correct, rather than the educate and promotion. So I would like to speak on behalf of the youth for that. I think WHO, they cover HICs and also LMICs countries, which means the line we can draw not to compare the health financing system of both categories, but from the right education and promotion. Right here stands alone, it means that it should be delivered to right people from the right people. And IPSF APRO here is not standing to say the treatment are not essentials, but what if in the process of implementing it, that still it meets some unavoidable gaps? Because other challenges in NCDs, for example, in the prevention, it includes the factors such as cultural belief, tradition, mindset, and even behavior. And therefore, I believe that although the services are essential to save the lives of those who are already deceased, they have not helped to slow down the growing epidemic of NCDs in the country. The question now is, how are we able to address that? I think we need the involvement of the community or the sectors outside health to be adequately involved, and the creation of an enabling environment, which is something very crucial for bringing about a sustained behavior change. And I believe that putting the young people in the center to educate and spread the awareness, equip the communities with understandable and strong health literacy, and even to monitor the trends of NCDs, and we revolve the stronger promotion and education strategies through national programs, it will actually have to focus on the reaching the underprivileged and also the unreached of the people. And of course, we also need to stress about the primary health care and universal health coverage components in these areas. And we need to be constant. Why we need to be constant? Because we tend to forget that constant helps to actually slow down the process and to be able in being NCDs free. It sounds very ambitious, but I believe that this is something very possible. Thank you.
Thank you so much, Mrs. Pujiani.
On that note, we'll be moving on to the next question. So this is specifically for Dr. Belizario and Professor Salenga. So the question is, which communities do you think are the most at risk for NCD-related morbidity and mortality? And how has the COVID-19 pandemic impacted our ability to reach these populations as healthcare professionals? So Dr. Belizario, why don't you go first?
Thanks, Samantha. It used to be the great urban-rural setting divide, but not anymore. It used to be that NCDs were more in urban areas than rural areas, and the main difference really the lifestyle and the environment. No, but over the years, no, in the past decade or so, it has changed, where NCDs now cut across different types of populations, whether they're urban or rural, whether they are young or poor, whether they are rich or not so rich. No, and therefore it's something now more widespread than ever. It's like an epidemic, that has actually gone out of control, and mainly because of lack of intervention, lack of awareness. No, I go back to the settings. No, and the settings really are a setting where lifestyle is suboptimum. The kind of food eaten, high sugar, high salt food, the fast food craze, as we experience it, especially in urban areas. In the Philippines, in the rural areas, there's already fast food also, Jollibee, McDonald's, Chowking, and all these things. No, the food, the lifestyle is also physical activity, where you have lack of physical activity that actually promotes more NCDs. And of course, one of the top-notch things now, especially in time of COVID, but which has gone, I think, worse. Now we're looking for the data and the information that should come out shortly. The stresses of daily living that actually push you on the brink of suffering from mental health challenges, which is also an NCD. And of course, we know for a fact the connection between mental health challenge and cardiovascular disease. Now this is well proven, and therefore it's a multifactorial phenomenon that actually needs to be addressed. No, it's not hopeless. No, as the previous speaker said, it's nothing hopeless, and we can actually be hopeful, but we do need to thresh out each and every major factor and try to address them, and that's how it is in public health. Now, I'd like to give more time for the other speakers to contribute. No?
Completely agreed with everything you said. So Professor Salenga, so I guess what Dr. Belizario kind of outlined is from a more public health perspective. So as a person with pharmaceutical background, is there anything pharmaceutical people can do to contribute to this?
Well, at the center of public health interventions lies the issue of access to medicines and essential commodities. So health technologies are critical instruments of public health. So if you are not able to access them in a timely manner, then that would cause a delay, or if not delay the treatment, it definitely impacts the overall outcome of health or disability, towards disability or even death. So in line with what has been mentioned earlier, I'd like to think that communities that are most at risk for NCDs are essentially communities that are in environments where the system is not supportive to adopting or taking in some healthy choices. As mentioned by Dr. Belizario, this is about lifestyle, about the environment. So we're looking at the power of the physical and the social environment and how those two critically determine our behavior, ultimately making our day-to-day choices. Like, for example, what food we eat, how much time we dedicate for physical activity, or even the social interactions that we do around people. And this, we have been mentioning as part of the agenda of the World Health Organization to reach the unreached population. And unfortunately, because of COVID-19, we can see definitely the impact in terms of the rates of visits of people to health facilities, even the quality of interaction between patients and even just regular people with their health professionals. That's impacting a lot. That would impact health literacy, adoption of healthy behaviors. And going back to medicine, if you are dealing with non-communicable diseases and you're having maintenance medicines, which are meant to be taken like for the rest of your life, and if you're dependent on the public health system's delivery or delivery of medicines or access to medicines, then COVID-19 certainly would be a problem in terms of distribution of this commodity. So I'd like to think that, again, communities that are in environments that are not supportive of adopting healthy behaviors, and by that I mean at political level, at the social level, at the cultural level, at an educational level, are the groups that are at most risk of non-communicable diseases. Thanks, Samantha. Over to you.
Thank you so much. So now we'll move on to the youth voice. So how can intergenerational leadership play a role in combating NCDs, such as partnerships between national and global organizations and youth organizations? So Mr. Chow, I think I'll have you answer first. So how do you think IFMSA can partner up with governments, the WHO, et cetera, to combat NCDs?
Thank you for that question. So I think from my perspective, we'll start off with the general perspective of youth organizations and how we can play a role in such problems. And I think we are able to reach or even better engage with populations such as school children, or even harness online platforms better, as this has been, we've grown up with these platforms and we're more familiar with it in a sense. And with the concept of the life course approach, it is important to start interventions or preventive measures early. And this is where youth can come in and we can have a say or contribute in terms of how the approaches are made, or even in academia. And this can really be not only a direct contribution to current problems, but also in a way capacity building for us to be able to better combat future issues that arise. So as of now, I think the approaches that are currently made are siloed. They're very traditional approaches are quite siloed. And now we're slowly seeing a transition to more cross-cutting themes and methodologies that kind of better reflect the realities of combating NCDs and other health issues. So in 2019, the world has the largest generation of young people in history, with 1.8 billion aged between 15 and 29. So, and we are able to kind of partake in decision-making because we come together and we unite our voices in organizations such as IFMSA or even IPSF. So we're able to intentionally and meaningfully engage as part of an intergenerational framework, because we recognize that the problems that exist are problems that existed maybe before we were even born, but there are still problems that exist today. And with that, I think that we have a new and fresh perspective, and maybe we can provide some innovative approaches. But with that there are structural barriers in where youth are still limited in terms of advocacy and leadership. And even if we are involved, it's usually siloed, as I mentioned, or even tokenistic. So it is our role as youth organizations, especially global youth organizations, to lead the change in terms of how we can start from global level and slowly trickle down to a regional, national, and even local levels in terms of how youth organizations and individuals can contribute to NCDs and other epidemics. Thank you.
For sure. I completely agree. So, Ms. Pujiani, what are your thoughts, and especially on the topic of advocacy on the youth side, what are your thoughts on that especially?
Okay, thank you so much for Samantha for bringing up this. I can't agree more for what Matthew has mentioned about academy or any kinds of like advocacy and policy involvement. But I'm standing here, maybe I just would like to say that we cannot avoid that youth and all of us here, we are the power of the crowd, and people listen to us. It is as simple as this in IPSF, for example, imagining that IPSF as the mother and the regional is the first child, and we have the national organization as our children and the behavior locals as their grandchildren. And when we are able to actually transfer the current trends, gaps, and also the challenges revolving around these issues, the information to foster the efforts and also to move the effects and hearts of young people is actually very needed, because we can be critical and we can be the decision maker of the problem itself. We are able to correct three populations by then. We can correct the populations of global communities, regional communities, and national and local communities that can trigger them all to understand about the NCDs so that they can use their knowledge to spread the information, be it through relatives, friends, or even lecturers or through their own social media. But if you see again, if the promotion or information we provide only stop in one hand, let's say it's just in regional body system, for example, we will not be able to make the impact to assist and stop it. And we cannot help WHO and member states in combating NCDs. And in addition to that, as an organization, we are the flag bearers to supporting youth participation and also their engagement at the grassroots levels and institutional frameworks. And also we are the umbrella to vocalize key concerns and to promote their engagement at all decision-making levels. Thank you.
Thank you so much. So on that note, we'll be moving on to our next topic, which is vaccinations. So Leonard, you can take it from here.
So given that we're talking about vaccinations, perhaps we could start with the pharmaceutical side of this panel. So starting with Professor Salenga, as a technical officer for pharmaceuticals at the WHO country office of Papua New Guinea, what have been your main observations regarding the challenges in vaccination uptake? Like, are there any differences between the challenges faced in high-income countries versus low to middle-income countries?
Thank you, Leonard. Before I proceed, I just want to comment the comments from Mathew and Florensia. I'm really learning a lot from them. And looks like our future is bright with the youth in you. So keep it up. Related to the question of vaccines in terms of how we view low middle income countries and high income countries. Well, I remember at the beginning of our discussion, Dr. Belizario was already mentioning that we shouldn't be looking at it in a traditional urban-rural divide. In terms of appreciating vaccination, we're not supposed to pit high-income countries and low-middle-income countries against each other, because when you look at the profile or the pool of high-income countries, they definitely do have different vaccination uptake profiles and even hesitancy rates. Same thing is applicable to low-middle-income countries, and precisely the same thing is experienced in our region in the Western Pacific. So I'd like to think that what drives this reaction, or what drives the ultimate attitude towards vaccine, is driven by not just the socioeconomic status of a certain country. There's so many things that are needed to be factored in. For example, cultural, traditional beliefs, the health system, the arrangement of how services are delivered. And this is very much an issue in the Pacific Island countries where I'm serving. In Papua New Guinea, our main problem is basically geographical barriers or geographical distances. There are many places here for you to do vaccination drive or vaccination campaign. You literally have to fly via helicopters. And if you don't do that, certainly people will not be accessing any of these essential services and essential commodities. So we also factor in the level of health literacy, how prepared, how well understood the concepts are by the people. And we're not just looking at one generation, but multiple levels or multi-generational health perceptions, because we understand from what we know in the past that certain beliefs are passed on to people, from mothers to their children and then children to other children. So that means to say that there is a strong role in terms of our health promotion efforts, in terms of changing the way they look at the value of medications, or vaccination rather, in preventing diseases. And also, just to point out, when you look at hesitancy, it's not really a huge issue in some countries because of the long-standing performance of the traditional vaccines, like what we've used to in terms of the childhood vaccination. So we have a good track record of those, and so people are quite comfortable in taking the vaccines. But we notice also that people tend to have negative reaction or initial reaction towards new vaccine. And that's the reason why it's critical for health workers and the health system to prepare the system and the people in terms of newly introduced vaccines. The reason why I'm pointing this out, it's because we are all anticipating the entry of COVID-19 vaccines into the market. And this is a critical agenda for all of us, precisely because if we're not able to prepare the system, instead of us using that as an opportunity to prevent further transmission of COVID-19, all research efforts will be put to waste. Most especially because of the power of social media. We know that many vaccination drives in the past were very much affected precisely because of rumors circulating through gossips, through the grapevine, and through social media. And so I'm encouraging the healthcare professionals to do an active role in correcting misinformation and to be potent vectors of correct information for the people. Because in what we're experiencing now with COVID-19, it's not just the pandemic of coronavirus, it's also the pandemic of bad information. That's the reason why we have the term infodemic. So in this space, we have to recognize that healthcare professionals have critical role to fulfill to guide our people in terms of appreciating the value of vaccines. Over to you.
Thank you so much, Mr. Salenga, for setting the direction for our vaccine segment, and also for sharing a bit about your context serving in Papua New Guinea, like what it's like there, a context that many even global health enthusiasts aren't really aware of. So I guess now we can move on to the rest of the panel. Similar to my question to Professor Salenga, what do you think are the main challenges in tackling vaccine preventable diseases in our region? Have we made any inroads in working towards solutions on this? So maybe Ms. Pujiani could start, bouncing off the farm perspective that Mr. Salenga already provided.
Okay, thank you so much, Leonard, and thank you, Prof. Salenga, for bringing about vaccine hesitancy. That's actually very aligned with the pharmacy prevention and also our background. So it's true that some of the countries, they are okay with the vaccine uptakes, but some of the countries, they might have the vaccine hesitancy once it is released. So, for example, in the COVID-19 terms. But when we are speaking about vaccine preventable diseases in the general, I think the vaccine hesitancy or anti-vaccine, they might occur due to the misinformation, like Prof. Salenga say, and also myths, and of course the religious beliefs or even untrust mindset, I believe, from the population. And how we can do that? We need to improve the transparency on the vaccine profiles, because people need to know the right information of the use of the vaccine. It must be something understandable for public in general. It should be accessible and affordable for everyone at all ages, so people can have more of the vaccines and then improve the standard of our health system. Well, I think pharmacy prevention plays a vital role in the prevention and also administration of the vaccines. IPSF always affirms and recommends everyone who involved to always invest in the effective implementation of the vaccination programs, education, and also multi-sectoral partnerships. And we always advocate that the pharmacy prevention involvement and also the services in immunization must be emphasized. Why? Because it can increase the accessibility to the vaccine. We always educate public and use our voices through policy statement to actually encourage vaccine manufacturers also in developing halal vaccine, for example. In roads working, it might not be fully effective, I believe, and also it might not be fully achieved. but we're all getting there. I think that's my point. Thank you.
Thank you so much, Ms. Pujiani. Dr. Belizario and Mr. Chow, do you have anything to add?
I think Roderick Salenga said it so nicely, but I want to just share a headline. The main headline is low coverage of vaccination. In the Philippines, for instance, we hardly reach our target of 90% fully immunized child. It's always way below 90%. And what happened during COVID? No, I think it's pushed down, all the more because of disruption of service delivery. Fear of going to the health center, fear of health workers going to the homes and the communities, etc. Just a little bit more on the low coverage. The vaccine hesitancy has been discussed so nicely by the previous speakers. I think there is a need for us to do quick assessments. Now, when there is a phenomenon in public health like a low coverage, it's important for us to go evidence-based. A very quick assessment. What is the issue? We can listen to the news every day, and in fact, we can listen to the not so good news every day. No, it's not the good news, the not so good news that you hear in the news every day, but that's not enough. Now, we do need to have some quick assessments guided by sound methodology that is already defined by the experts. Do quickly so that we're able to identify what are those issues. So that, if you play archery or darts or target shooting, you see the target well lit, and you can visualize the target and you can try to hit the target. What seems to be causing the low coverage? Now, is it misinformation? Then you have to neutralize the misinformation. Misinformation is like poison. Now, you have to give an antidote to the poison. But preferably, before the poison is given, you already prevent the giving of the poison. If the poison is already given, you give the antidote. But many times, as has been seen even in the Philippines, the poison was allowed to actually spread systemically, so that it was so difficult to give the antidote. So I just like to highlight also, Leonard, a nice practice, a very good practice shared by our Malaysian colleagues in a webinar on COVID some weeks ago. Southeast Asia TropMed network, our friends from Malaysia, our colleagues from Malaysia, when they describe the relative success versus COVID-19, they had one specific strategy formulated in their list of strategies against COVID. They have a strategy against fake news. They already anticipated the giving of the poison. Versus let's wait for the poison to come. That's the time we will act. So that is good public health. You anticipate, the poison that is about to be given or that might come out, so that the poison doesn't spread. So the fake news is a major concern, and therefore comms. I'd like to raise the issue of comms. Communications, extremely important. That's why in the College of Public Health, one of our key departments is health promotion and education, which actually deals with the comm side of things. Believe it or not, the doctors or nurses sometimes are not the best communicators, but there are communication experts, and there are communications experts in health. That's why we have a field called health promotion. Something for young people like yourselves to consider in the future is a career in health communications. You're going to shape the minds of the people. You're going to provide the antidote for the fake news. You're going to prevent the fake news from actually spreading in the system. So comms, I think, is one of the other headlines I want to push for the young people. This is a field that must continue to grow, so that we're able to strengthen public health programs, including vaccine preventable disease control and prevention. Thanks, Leonard.
Thank you so much, Dr. Belizario, especially for highlighting the importance of health communication in dealing with problems such as the pandemic. And it definitely the right audience. I'm sure there are many public health enthusiasts in our audience today from all over the world. So now, Mr. Chow, do you have anything to add?
Yes, I'll just quickly add on what has been said, because the previous three speakers have so comprehensively covered the answers and what I was planning on covering. But I just wanted to retouch upon the fact about a lot of the people of the low, not necessarily, we don't have a low vaccination coverage rate in the Western Pacific region, but of the people of that maybe 10 or 5%, it's consistently the same people. And so that also targets to how we have to target the vulnerable, target those who are consistently misinformed and their perspectives are not changed by current public health or communication campaigns, and how we can, as healthcare professionals or public health professionals, play a role in minimizing that 5%. And so one approach would be using more novel efforts to track vaccine hesitancy, especially with the COVID-19 vaccine that's coming out, and such as the use of social media and Twitter, and how people voice their opinions on social media platforms, and how we can track vaccine hesitancy based on, for example, when a government comes out with a response, or when there is a massive adverse effect in a COVID-19 vaccine trial, and how that plays a role in vaccine hesitancy and acceptance. And I remember, I think a few weeks ago, I was reading Professor Heidi Larson's, one of her studies on the vaccine hesitancy in terms of the COVID-19, and respondents in that survey said that high levels of trust and information from the government sources were more likely to accept a vaccine. And that highlights the role of member states and governments in the role of communication of these efforts, not only from NGOs and non-state actors in a sense, but also from the governments themselves, and making sure that they have a consistent and sustained informed information so that the general public and the population are well informed. Thank you.
I think what Dr. Belizario and Mr. Chow have just covered regarding inequities leads in perfectly into our next question, which is how has COVID widened pre-existing inequities in our society, which in turn caused disparate experiences of the coronavirus? So, and then when a vaccine victor is established, how do we ensure that no one is left behind vaccine coverage? So I guess this question is two parts. So first, how have the inequities in society led to different people experiencing COVID differently? And how do we then make sure that we target the most vulnerable when we have a vaccine available to us? So I guess I'll start with Dr. Belizario.
Okay. So as I mentioned earlier, COVID has really challenged all of us. Nobody's spared. No? And of course, even public health programs like vaccine preventable disease control and prevention, suffering immensely. I can imagine. I'm looking forward to hearing and seeing the figures. So what do we do? So COVID is there's not much you can do in terms of what has happened. We move forward now, and therefore talk about catch-up plans. Catch-up plans. We suffered a huge setback, disruption of public health service delivery. Vaccine preventable diseases, suffering immensely, I can imagine. The other night, I was listening to the news, and the Department of Health of the Philippines was predicting that next year, expect measles outbreaks. Can you imagine that? And of course, measles is such a terrible disease to get, because a lot of children in the Philippines suffer from bronchopneumonia, and oftentimes their mode of exit, they actually suffer and die because of bronchopneumonia as a complication of measles. Mortality rates actually increase when you have complicated measles epidemics. And therefore, a catch-up plan is very, very much needed. And when I say catch-up plan, it cannot be, Samantha, something that we will just resume what we were doing before COVID started. No, because we were affected by an extraordinary phenomenon. The catch-up plan must be also extraordinary. And therefore, it will entail creativity and innovation. In public health, there is so much room for creativity and innovation. Young people, I know you are not short on creativity and innovation, bright ideas, how to reach the unreached, how to reach the difficult to reach, how to reach those who are left behind. It's never hopeless. And of course, we're never alone. We need partnerships and collaboration. There are people who are frontlining, and we should help the people in the front lines. We will not always assume that we will be in the front line, because we will never do that. No? So and therefore creativity and innovation and the partnerships, the extraordinary catch-up plans, no, innovation, these keywords I think should be kept in mind. No? And I look forward to hearing, the good news, no, about the innovation that will happen. And we want to be able to support some of these initiatives and then come up with the case studies so that people will actually follow models. And thus it's not hopeless. And I look forward to better days ahead. Thanks, Samantha.
I think we all do. Thank you so much, Dr. Belizario. So I guess that leads in beautifully into my next question, which I think I'll address to Mr. Chow and Ms. Pujiani, which is, could you two highlight some of the student-led initiatives within your region that have left an impact on the topic of vaccines and immunization? So, have there been any student-led initiatives within the region regarding vaccine coverage, and how do you think we can harness youth efforts to aid in disseminating help regarding the COVID-19 vaccine in an equitable fashion? So I see Mr. Chow nodding his head, so would you like to go first?
Okay. So from the perspective of IFMSA, we work both in terms of external and internal efforts. So in terms of external, we most recently did a statement at the regional committee meeting for the Western Pacific on vaccines. And this was guided by our vaccinations policy document, which was adopted in March in 2019. And so IFMSA has a very robust policy process and policy document that guides our entire external work and advocacy efforts. And these are our guiding documents to approach externals and approaching partners in terms of how we, as a federation, as medical students and as medical student organizations, how we think and we can contribute to the issue of vaccinations in terms of the problems that we face right now. And maybe in terms of a concrete internal initiative that has been done is we made something called a vaccination training manual. And this was an interregional effort between the Asia Pacific region and the European region, as at that time, both regions felt that vaccination coverage and vaccination hesitancy was something that needed to be tackled on a national and local level. So this training manual delivered essential knowledge of vaccination and kind of tips and tricks for campaigns, advocacy, and trainings for national member organizations in IFMSA to conduct. So essentially a national level or local level activities. And these toolkits, in a sense, are for our members to use so that, as we mentioned previously, the importance of context-dependent and context-specific interventions in terms of public health, because often when we're trying to reach certain targets, we have a blanket approach in past, and now we're kind of transitioning and focusing on more context-specific approaches, which is essentially what this training manual is trying to contribute to. So I think as future healthcare professionals, it is our imperative to teach the general public about the importance of vaccines, and it falls upon us to to treat patients for their illnesses, but also contribute our skills and knowledge directly to the community. And as a federation, so IFMSA has committed to the vision of universal health coverage, and within universal health coverage comes universal vaccine coverage. And we do, on an NMO level, vaccination drives, campaigns, health literacy promotions. And so it's an important point to note that we have to start from the bottom up as well, not only from the advocacy, global advocacy efforts. And that includes local level activities, capacity building, education, and sharing best practices. Thank you.
Thank you so much, Mr. Chow. Ms. Pujiani, do you have anything to add regarding the role of pharmaceutical students?
Okay, thank you, Samantha, and thank you, Matthew, for bringing this up. So for the IPSF APRO perspective, we also always put vaccines and immunization awareness in our agenda or our annual plan throughout the year. For example, we conducted successfully public health awareness competition for our members about immunization comic poster competition to let our members involved in the critical thinking and how they can use the creativity to enhance the awareness of immunization to the society, which has already reached out to more than 30,000 impressions and outreaches to our members and the community. Besides from that, as for vaccines related, we just successfully also conducted an event in partnership with NUSP Singapore as our previous Asia Pacific Pharmaceutical Symposium host, and also Sanofi to conduct Beyond Health Hack, which is a hackathon, which focuses about a vaccine, influenza in particular. This is actually the first Asia Pacific hackathon where we also invited IFMSA at the time, and it had more than 200 youths participating to give their ideas to solve the issues of vaccines. And also, we conducted the webinar to invite International Vaccines Institute, Dr. Jerome Kim, the Director General, to speak up to our members and participants about vaccines from his perspective as a vaccine developer and expert. And we also give another perspective, for example, in the business development of the vaccines and etc. This actually helps for the youth to be able to give the innovative solution for the vaccines, which is related to what Mr. Belizario has mentioned before. And in terms of policy and advocacy, what IPSF has been always done, and IPSF APRO, we have the Vaccine Hesitancy Advocacy Toolkit disseminated to our member organizations so that in the national level or local level, they can use this to implement it to their local communities. We also had a side event about vaccines, hesitancy, and etc. And I think the key points are creativity, leadership, and communication. And that's how we survive in order to also assist WHO to accelerate the progress for this. Thank you.
Thank you so much, Ms. Pujiani. Actually, that's how I met Mr. Salenga here. I participated in the hackathon that IPSF organized, and we consulted with Mr. Salenga. Anyway, we can now move on to the next portion of our panel discussion on intersectional collaboration. So for the first question, this is addressed to everyone in the panel. How do you think are these two health issues, NCDs and vaccinations, interlinked? And what are the factors in your country's public health systems that contribute to these weaknesses? So maybe we can start with Dr. Belizario.
Okay, Leonard, I have acronyms PPP. So the first P is really public health. No, as providing us the tools to be able to address the challenges posed by the two major public health concerns. Public health is really coming up with solutions. No, and I like listening to the previous speakers, no, because the young people, the young leaders, no, the future, you are our future. No, come up with so much creativity and innovation, no, to enhance service delivery. And this is the way we go in public health, no, not business as usual. We use our talents, no, we use our energies to actually find solutions to reach the unreached. The second P is actually talking about having to review the kind of policy we have. And I just hope that in the countries in the Western Pacific region, you know, of course, the HICs are probably on time, no, in terms of having updated policies and guidelines. No? There are LMICs where policies and guidelines are outdated, you know. I cite, for instance, my area is on NTDs. No, the NTD policy of the Philippines is a bit way behind. You know what the WHO is saying, what we should do, what we should doing, and I'm really hoping that in terms of NCDs and vaccinations, we are up to date, no, with our policies, because the policies shape the kind of things that we do in the communities, that shape the way that we think, the things that we do in the health facilities, whether these are health centers or hospitals. You know. And lastly, you know, actually it's 4 P's pala, 2 more, no? Service providers, no, the practitioners, the service providers. I'm talking about the health workers, not just the doctors, nor the nurses. I'm talking even about the medical technologies, the laboratory staff, no, our allied health staff, the midwives who are frontlining service delivery in the community setting. You know, we need to empower them, train them well, so that they're able to give quality service in terms of vaccine provision, service delivery, as well as delivery of NCD services. And lastly, the people. You know, the last P is the people. the population that actually is the recipient of all these services, no, you will be surprised. No, the services are already being brought to the community, and the people might refuse. You will be surprised. The NCD drugs are available, Roderick, Salenga, no, in the health centers, but people don't take their antihypertensives. They don't claim their free medications. So what is the issue there? And I go back to my earlier message that we need to do rapid assessments. No? Social science, which is another fascinating field in public health, provides us the tools to rapidly assess what is going on so that we can try to hit the target, the bullseye that is causing us, diminished or reduced coverage of these services and people not complying, with what they should be doing. And thus PPPP, public health policy, making it sharp and updated to guide the practitioners. The third P, quality and access. And lastly, the people, the awareness, which is actually addressed by health promotion, no? Again, in public health, no? Really, public health, no? Probably leading the way to better NCD prevention and delivery of vaccine-preventable disease services to avoid vaccine-preventable diseases. Over to you, Leonard.
Thank you so much, Dr. Belizario, for the acronym, for accentuating the importance of such a multi-pronged solution in dealing with NCDs and vaccination. Maybe next we can have Mr. Salenga. So again, the question is, how do you think are the two health issues, NCDs and vaccinations, how do you think they're interlinked? And what are the factors in your country's public health system that contribute to these weaknesses? So maybe from the Papua New Guinea point of view.
Thank you, Leonard. Well, NCDs and vaccinations, these are health system phenomena, and they're not supposed to be appreciated simply or purely as biomedical issues. These are issues that go beyond clinical dimensions. And so in that sense already, we can say that these public health problems are sitting on critical items of accessibility, quality, availability. When I say availability, I'm referring to services and products. And then, of course, we're looking at acceptability. Again, putting emphasis on culturally appropriate methodologies, because at the end of the day, even if our services are the best ones in terms of technical and scientific caliber, if they are not acceptable to the people who are the end users, then we'll have a big problem in terms of implementation. I think the way that I will be approaching this question is focusing more on the opportunities rather than the challenges. I would think that, especially now with COVID-19 experience, we have seen that there were so many instances that we are no longer working as a sector. There were so many good examples of inter-agency, multi-sectoral arrangements, because now we realize that many public health problems can never be solved by individuals working in silos, that they are never going to be solved by sectors working independently of each other. And that's precisely the reason why we have the Sustainable Development Goals. We're looking at health as something that cannot be achieved unless we have the other determinants of health, the social determinants of health, other facilitators of development. And so I would think that COVID-19 sort of paved the way for us to appreciate that it's possible to be working with others. And when I say working with others, I'm not just looking at agencies like the Department of Transportation, working with the Department of Local Government, the Department of Health, and even the Department of Tourism for that matter. But at the individual level, in terms of the health professionals, we're seeing now how critical it is really to be working in an interprofessional collaboration model. And I'm very thrilled that this discussion, even if this is an IFMSA activity, I'm very happy that Florensia is here representing the pharmaceutical students. This is an example of how we can sort of support the dialogue, the discourse in terms of revealing our strengths, as individual professionals, and us together working working, tackling public health problems that are way beyond all of us if we are working separately. And then also another opportunity which I would want to put forward is people's participation. Now we realize that even if we have good policies, let's say, for example, many restrictions like the lockdown, for example, if people are not equally engaged and equally invested into this problem-solving effort, everything will fall flat. So it is important that when we look at public health problems like NCD and vaccination, we don't engage them only at the terminal end. We don't look at them as passive recipient of services. We have to enable a system or an environment where they become active contributors from the time that we are conceptualizing the program. You know, oftentimes I would say to my students back in the day when I was teaching the undergraduate, who is really the boss of the health system? Who is really the boss of the medical team? Well, some of them would say the doctor, some of them would say the pharmacist because they're pharmacy students. But at the end of the discussion, they would realize none of these two or none of those that they've listed are the bosses. The bosses are the people, because the only reason why we all exist as healthcare professionals is because we have patients. And so if we are doing processes devoid of people's participation, then we are actually doing meaningless interventions. So I would like to think that for us to address NCD and vaccination issues, to improve coverage, at the very beginning, we have to involve them. A true public health policy is representing the aspirations of the people. If you don't put the person or the people at the center of it all, it is not going to work. So those are just some of my realizations, especially now with the COVID-19. Thank you.
Thank you so much, Mr. Salenga, for highlighting the role of interprofessional collaboration. So we actually released a statement together with IPSF. So hopefully more collaboration with pharmaceutical students. And at the same time, thank you for pointing out that the people are really the binding force for both professions. It's like the commonality that we both have as as healthcare professionals. So next, Ms. Pujiani, perhaps you could get your insight on the question. Again, it's how do you think are the two health issues, NCDs and vaccinations, interlinked? And what are the factors in your country's health system that contribute to these weaknesses?
Okay. Thank you so much for that. I just did the research about it as well. Like, I was pretty confused how I can link this. So what I found out is like we need to realize that the major group of NCDs also includes like CVD, cancer, and diabetes patients, and vaccination is one of the most cost-effective and also efficient to help with that. This is something that I realized. And let's take an example that what WHO addressed before about the interlink between NCDs and vaccinations. So the WHO has already addressed that that's the provision, for example, in the scientific level. HPV vaccinations to the adolescent girls has been shown that it is to be the cost-effective as part of the comprehensive approach to the cervical cancer prevention. Vaccines also help avert millions of premature deaths by preventing, for example, the infections of hepatitis B and also HPV that cause into leading cancers in developing countries, such as liver and cervical cancers, which are the root problems of NCDs, and there are the needs of vaccination that must lie on the lifestyle and also other side factors. For me, I think due to this difficult time, we must understand that we will need to adapt in the way to think and in the way to act. As the healthcare profession, we must ensure, like for example, the target population understand how we can empower people to protect themselves and others and prioritize public health basics such as hygiene, because this is actually the basic things that will be also connected to NCDs, vaccinations, and with COVID-19 during this unprecedented time. This has been also mentioned earlier in the WHO RC meeting 71st by the WHO Pro by Dr. Tedros. So I think the approach should be about how we can all teach people to do the self-medications without the face-to-face meeting, increase the physical activities, and also the healthy lifestyles and medication adherence. I think this is the things that we can help for the gap. Thank you.
Thank you so much, Ms. Pujiani. Mr. Chow?
Yep. So from my perspective, I think that both of these issues, NCDs and vaccinations, have been, as I mentioned in a previous answer, that we currently take very siloed approaches. And so what we need to do is break down these silos. We need to smash them. And so we're able to have a whole of society approaches where we involve different stakeholders, including youth organizations such as IPSF and IFMSA. So we're able to reach the unreached. And so I think part of the question was also from where I'm from and how the public health system contributes to these weaknesses. So I'm from Hong Kong. And so we have a society with the longest life expectancy in the world. And so we have accumulated a survival advantage over other HICs and of course, LMICs as well, with a decline in mortality and infectious diseases. But with this, the burden slowly shifts to NCDs, such as hypertension and diabetes and all the complications that come with it. And these issues they are derangement of bodily functions in a sense, but they go beyond that. And they have ramifications on family functioning, social functioning, and even political and economic functioning. And from my, the public health system in Hong Kong has updated policies and guidelines for both tackling NCDs and vaccinations, but time and time again, it's the same groups of people, the same vulnerable groups that do not engage in our public healthcare system. And this is, in a sense, it perpetuates these inequities in the community. And so this highlights the role and where we step in as NGOs and how we can collaborate with governmental organizations and other NGOs in supporting these populations so that we can understand, once we do, from, as mentioned by Professor Belizario, about rapid assessment of all these different barriers that we face and these challenges as time goes on, and how we can support these populations so that they engage with the healthcare system in terms of health-seeking behavior and continuity in terms of compliance. And so this highlights a type of health systems approach to both problems, but also the importance of involving the people, as mentioned by previous speakers before me. And so in essence, both issues are long-standing issues, but they're also very dynamic and they change over time with different health issues and how they intersect with each other. Particular in this case, in this era, is the COVID-19 pandemic, and how this has kind of rejuvenated conversations and has given us different perspectives in how we tackle rather pre-existing or old global health issues.
Thank you so much, Mr. Chow, and to all the panelists for such an insightful round. Next, we have a question from Facebook. Sam?
Yeah, so this is specifically for Dr. Belizario. So a viewer has mentioned that you mentioned about putting more resources into public health promotion via personnel specialized in communication rather than using doctors or nurses for that function. So what do you think are the advantages of this? And do you propose this because of inadequate communication training for doctors and nurses? Or do you think that it's important to have separate personnel for communication purposes to alleviate the burden of communication from healthcare workers?
I think the answer is something related to communications being a specialized field by itself. The University of the Philippines, for instance, has a college of mass communications. Who can beat a college of mass communications? Vis-a-vis a department in the College of Public Health called Health Promotion and Education. I always say, and I'm dean now, I'm challenging the department head of the department. Can you join forces with that college? Because I know that the experts in communications can actually enhance the way we do our health promotion. And it's really a joining of forces. Where there is no monopoly of expertise in any public health school. nor a medical school. Sometimes medical schools sound so confident, we're okay with this and we're okay with that. Oh my gosh. Sometimes they cross the border and they touch on public health, but they actually talk about diagnosis and treatment and diagnosis and treatment. And in public health, it's much, much more than that. And hence, I'd like to close my answer by saying the need for us to really cross the border and work with the different sectors, because the joining of forces in public health makes a whole lot of a difference. Communications really is something that we'd like to highlight, because I think with very good health communications, a lot of our programs will work more nicely. The last message is this. When I was Undersecretary of Health, Roderick, I was Undersecretary, and the Health Promotion Bureau was assigned to me. It was actually a health promotion and communication service, downgraded from a bureau. So enlightened leadership that downgrades health promotion from a bureau to just a service. Can you imagine that? Instead of moving forward, it moved backward. All right. I said, health promotion communication service, you are like rice or bread. Because all viands, whether it's Chinese food or Japanese food or Korean food or Filipino food, it will require rice. And therefore, health promotion is a staple in public health. It cannot be minimized as a small service. We're doing it, we're putting up posters. Who's reading your poster? No, it's not affecting behavior. So what you're doing is probably lacking in usefulness. So communications, I think, is a major field, young people, that you might wish to consider. Public health and communications. Oh my gosh. Your power is going to be endless, I think. Over to you, Sam.
Thank you so much. So, Dr. Salenga, do you have any opinions on this, having worked in organizational level as well?
Thank you, Sam. I guess I just want to add few items here. Maybe this is an opportunity for me to again encourage you to further the interest in the field of public health. As a pharmacy professional, pretty much our career tracks are quite fixed already. I can either go to community practice or hospital practice or manufacturing, but none of those appealed to me. And so I said, I feel like as a healthcare professional, I would need some kind of human interaction. I would feel that I would be of value if I have direct influence on health outcomes. And I felt that public health provided that to me. And I benefited from the training from the UP College of Public Health. Dr. Belizario was my teacher in parasitology. I'm a proud alumnus of the College of Public Health at the University of the Philippines. And I would think that in the current context, people who are working in this field would really have to examine what skills they have to bring forward so that they are more relevant. Because as mentioned earlier, we are not in a we are not under usual circumstances. We are definitely seeing a different paradigm nowadays. COVID-19 showed us what are the weaknesses and strengths of the health systems. And I would think that more weaknesses were shown to us. And even those that we thought are quite advanced are not actually delivering. They're quite failing in many aspects. So this allows us to have some sense of purpose and also an urgent need. Things come to mind like the concept of agility in leadership. These are the skills that we don't have usually focus in our clinical or pharmaceutical training. The importance of interpersonal and social communication. Our conceptual skills in terms of looking at it in a bigger, looking at it at a bigger picture, and your ability to connect the dots. Because our tendency, because of our hyper specialization, we tend to appreciate a single item into the whole system as if that's the only thing that's existing. When in fact, for us to have a derived meaning out of the experience, we have to see the other bullet points or the other points in a particular frame. And only then we realize that there is something that's happening that needs to be tackled, not just by you, but by people who are like-minded, people who can potentially become your partners. At the beginning, maybe you'll have some resistance, but because of your ability to build the rapport and your ability to make networks and alliances, which is also critical public health skill, you will be able to embolden the community to adopt certain behaviors that would benefit them in the end. And also, I just want to mention again, the concept of working together. You know, in public health, this is what I realize, and I'm sharing this with all of you. You know, your background in terms of academic training, that comes as secondary to what you can really offer in terms of skills, in terms of interest, and in terms of sincerity. Because, you know, I think public health workers, those who are interested in this area, they should first and foremost have that sense of purpose, because it's also quite frustrating. Your public health problems are never ending. You know, when you create solutions, they make new sets of problems. So that's making our work quite exciting. And so I feel that if you have that sense of purpose and sense of mission, you know, you will really walk extra mile, so that people that you want to serve will really be served by the kind of work that you deliver. And so again, the idea of us working with partners, the idea of us, you know, preparing ourselves beyond our clinical skills, so that we become effective public health leaders, so that we will help our target beneficiaries so that they can reach the endpoint where we want them to be. I think that's the message I want to send across, Sam. Thank you.
Thank you so much. So I think Leonard is going to close us out with the final question for the day.
Okay. Yeah, since we're nearing the end of the session, we'll head to the call to action part. So from your perspectives as students and educators, so maybe we can start with the students. How can the youth be more involved in the decision-making process for health agendas? And how can we realize this goal in the current health emergency and those that may come in the future? So perhaps Ms. Pujiani could start.
Okay, thank you so much for that. So I think I believe that youth should be listened, and they are not the weakest in the public health knowledge. That's actually their strength. In fact, they give a lot of brilliant ideas to solve the issues, and they live to serve the people. I think everyone needs to invest in the development of youth and also allow them to give the intervention to support their ideas and also to support the needs of the member states and multiple stakeholders. I think in order to align, for example, in the GPW 13 agenda by the WHO, they are already covered 4 strategy areas. For example, the leadership by putting youth in the overall strategy and then let them to be the lead of the health. And then country impact through the evidence-based policies, for example, to strengthen their advocacy, global public goods, for example, through the research and innovation, and even the partnership by having strategy partners to engage with the youth. However, I think among these areas, it still needs to be strengthened because I still can see that there are a lot of uncertainty that young people feel to contribute further with this. The insufficient integration in the education and also programs for young people that have been mentioned earlier, and even the limited support for us to even drive the local, national, regional, and even the global impact. And to make sure that the member states, they are aware that young people are visible. So they must invest more, they must leverage our accountability in the strategy, and we can even help with surveillance once needed. And in terms of the schools, for example, according to my own experience, if I'm not engaged with the organization aspect as this, I might not be fully aware about the public health. Even NCDs, I will just focus on the treatment. But this kind of platform allows me to understand further and to dig more that a health issue is not just limited to the treatment, or it's not limited to just medication adherence. It's something beyond more that you need to also contribute to be able to address the concerns and solve the issues and then fix it in the future because we are the young people and we are actually the agents of change. I think that's all. Thank you.
Thank you so much, Ms. Pujiani. Completely feel the same way about IFMSA. And I'm sure Mr. Chow has more to say given that he's been in the organization longer.
Thank you, Leonard, for that. So I think from an IFMSA perspective, we share the same values and the principles as IPSF in ensuring that the youth voice is heard, they're listened to, and that we are visible. And so what we try to do for now, while the traditional siloed approaches are still there and the youth tokenism is still there, as we try to break those barriers. Simultaneously, we also try to lay the groundwork so that when apt opportunities arise, we are prepared to take them on. And this highlights the need for capacity building and education of both youth, as when we are students, we are equipped with opportunities and lessons, both whether this is soft skills or informal lessons, or whether this is directly incorporated into the medical or healthcare professional curriculum, and making sure that these essential portions are alerted to these students so that they know that these things are important. As the current medical, at least from my perspective, the medical education curriculum is quite limited in the sense that, as Professor Salenga mentioned, that we're focused on a few bullet points, but often we miss the other bullet points that exist in society. And that highlights the importance of engaging with platforms that you're able to broaden your horizons and your perspectives on the current issues and even the future issues that what we will face. And so for example, in this current health emergency, we have partnered with NGOs and IGOs such as WHO, the UNFPA, and the UN Youth Envoy on COVID-19 related projects. And we did surveys with them on highlighting the mental health impacts of youth on COVID-19, as well as mapping and fact-checking organizations in combating misinformation, and how this is, again, not a new issue, but it manifests in a novel way with this COVID-19 pandemic. And in the same vein, we also looked at the impact of COVID-19 on medical education and how that has suspended a lot of classes and current curriculum, and how, for example, clinical and bedside teachings have to be suspended in many different places, or where some medical students who are final year are fast-tracked, so they're graduated and they're helping with the current healthcare workforce. So these manifestations or these impacts directly affect our population as youth. And so this again highlights the importance of why we have to be involved in the conversation, because when we realize that these things do impact the youth and as a population, whether this is medical students or the general youth population, then that might be too late. So we have to be involved from the very start at the beginning of these issues. Thank you.
Thank you so much, Mr. Chow. Now for the educators in the panel. So from your perspective as educators, how should one motivate the student body to increase their involvement in global health activities? So maybe Dean Belizario can start. Oh, sir, you're muted.
I'm sorry. All right. So I think keep in mind that it's important to dive in and get involved. No, don't be bystanders, fence sitters. No, just part of the audience. Come up the stage. No, I think your organization, IFMSA, provides a stage, where you're engaging different parties. You're dealing with educators, experts, administrators, etc. And this is a very good way to go. You need to engage in discussion. In your academic training, of course, in the undergraduate academic training, Mathew is right that the usual health professions education will not be enough. Our challenge as medical students, pharmacy students, undergrad public health students, nursing students, we need to pass and pass the board exam. All right, that's good. No. And the way to go really is to push higher, to actually move on to some graduate form of training, so that there is some formal training of sorts, and you get a degree that defines an expertise, in the health professions, whether it's public health or masters in nursing or whatever, or masters in pharmacy or whatnot, because the mastery Now, with it comes the ability now to be more critical about looking at evidence, being more critical now, and being able to do research, and you yourself contributing to generation of knowledge, so that you can contribute new information by way of publication, presentation in national and international fora. You can contribute to discussions in policy making, and looking for better ways of doing things. No? So really moving upward to graduate level type of education. And of course, choose a good school. Not a good school that gives you very good practical experience. Now, global health, you will need to really move out to communities and see the different scenarios. Now, it's not something learned just in the classroom. You will need to do internships. Now, we, for instance, in the University of the Philippines, accept medical students from the University of Pittsburgh, where they spend a summer here and they do a summer research project. And believe it or not, these brilliant students are able to publish manuscripts publish manuscripts in scientific journals just with their eight-week stay in the Philippines. So something like this that really immerses you to the realities of the day. I think that's the best teacher of all. You're able to imbibe, what needs to be learned, and then it will stimulate your senses. Now you will realize what you really want. Because the challenge in life really is to choose something that you will enjoy doing, something that you will find fulfillment in, so that you can contribute to making people's lives better. I like Roderick's stance about people being the center of things. I call the people the stars. No, because the people are the objects of our services, of our efforts as healthcare workers. It's not enough that you deliver the service, but in public health, we want outcomes. We deliver the service, we improve vaccine coverage, we've delivered the antihypertensive drugs or the anti-diabetes drugs, but did we prevent mortality? Did we arrest malnutrition? Have we reduced stunting, for instance? The Philippines, #1 stunting in Southeast Asia. Can you imagine that? And it's not enough that you feed and feed and feed. We've done feeding all this time, but the Philippines remains #1 in terms of stunting. So again, there are underlying factors that you need to understand so that you can correct the root causes of the things that plague the young children. So it's a very exciting time for young people. No time like this where public health is put in the spotlight. Where public health is supposed to help provide solutions for COVID-19. Note, it's not only public health that will provide the solutions, but I like to see public health as leading the delivery of the solutions together with other sectors, a major player. Not just COVID, but vaccine preventable diseases and non-communicable diseases as well. So I look forward to further interaction with you young folks. Okay, thank you very much, Leonard.
Thank you so much, Dean Belizario. Mr. Salenga, the closing.
Yeah. Thank you again. Thank you very much. I really learned a lot tonight, and I thought that I will be like a panelist. I am actually more of an audience, learning from my co-panelists. It's really a privilege to be with you today. I have a very short closing statement. Well, I'm sure you are familiar with this culture, the culture where I come from. When elders are speaking, the young people should keep quiet, right? I mean, when they talk, we should be quiet. I think being involved does not mean being disrespectful at a very young age. I'm talking about youth participation here. I think that no one is ever too young to be involved. 10 years ago, we formed the Young Pharmacists Group Philippines for the simple reason that we feel that the young should be well represented in the discussion of pharmaceutical issues in the Philippines. Because if we are to take hold of the future, why are we only waiting for that to happen? I mean, the involvement will only happen 10, 20 years, when in fact, the future is being discussed now. And we fought our way towards establishing that. And I think we're winning because the organization is now 10 years old. And we have many units across the country. And we even have our Asian Young Pharmacist Group acting like a development catalyst in the pharmaceutical space in Asia Pacific. So I think we are winning in that sense. I would want to always remind you that at this particular stage of your lives, you have the energy, you have the creativity, and you have the optimism. Those three things are powerful gems, you know. They are potentially can change many things, you know. I would say that optimism shouldn't be looked at as a weakness, but rather it's a potent force for you to be doing things. I think there's nothing wrong with being optimistic. Of course, we have to realize that there are things that cannot be done, but there are things that there are many things that can be done. So I would want you to harness your power, your energy, your innovation, and your optimism. And lastly, I just want to emphasize this, that at this point in time in your professional life or as in your academic training, I'm really encouraging you to expose yourselves. Continue working with organizations like this, continue interacting with people, because learning happens not only inside the classrooms, not only inside the hospitals, not only inside our consultation. And the best teachers are out, or not just the formal teachers in the classroom, talking to common people, you will learn perspectives that you thought were not so useful or not so important, when in fact in the future, those are the critical ones that you need for a fruitful and happy professional contribution. So I guess that's the point. You're never too young to be involved. So keep on engaging, keep on interacting, keep on contributing. So more power and success to all of you. Thank you.
Thank you so much. So unfortunately, we have reached the end of this session, and we thank all of the panelists for generously contributing your time and your wisdom on these topics. So before we end the call, we invite the panelists to join us in a group photo, and I think Leonard is in charge of that.
Okay, take the screenshot. 1, 2, 3. Perhaps the other organizers in this call can join. You can turn the video.
If you would like. Lisa
Teresa.
and Chicia. Unless they're busy.
Okay. 1, 2, 3. All done.
Okay. Thank you so much. So I know that Leonard and I and the rest of our delegation and all of our participants will definitely be taking home a lot of these important messages we have just heard tonight. We also thank all of our observers on YouTube for all of your wonderful questions. And we wish you all a good night or day wherever you are, and hope you all stay safe and healthy, especially in these turbulent times. So thank you once again and have a good night.
Thank you.
Thank you.
Bye, Eric.